No, I didn't really know what I was doing. I was like hoping and praying that things would turn out right and that.
This is bonkers. Please go watch that video and then come back. So this person is talking about how they learned to do liposuction, apparently, which is YouTube videos and mentors, apparently, in some courses. And they say in the video that they were terrified at first that they wouldn't have the skill set to treat complications. So why would a surgeon say this? Because they're not a surgeon. This person did no surgical training. They have 1 year of training after medical school in a transitional year residency, which is a residency that does not focus on one specialty. They jump from specialty to specialty every few months. No surgical residency, zero. So yes, I would agree. That is something you should have been terrified about, and you still to this day do not have the skill and ability to manage complications. As it appears on the Medical Board of Florida website, you don't have hospital privileges and you also don't carry malpractice insurance, which is wild. So in the comments on this video, Dr. Fran was like, what did you learn in your surgical training? You didn't learn liposuction? And then of course, this person says, no, they learned from mentors, CME courses, textbooks, and YouTube University. That's the point of the video. There's different paths to get to the same level of proficiency. Ma'am, you truly think that you have achieved the same level of proficiency with this education as someone who did multiple years of training, a board certification, thousands of operations in said specialty? And then later they say, I am not plastic. So now she's admitting she's not a plastic surgeon, because online there's a few places where it says she's a plastic surgeon. And she says for plastic surgeons, they usually need additional training. No, we don't, to do lipo because it's not a focus in residency. How would you know? You did a transitional year at a hospital that doesn't have a plastics training program. How would you know? And then someone else had the same thought I did, because this is a weird thing to say out loud with no one asking online, right? Like, I don't know if I'd admit to this if I had this level of training. Why are you admitting this on social media? And they say it's more common than people think how many of us watched one video before placing a central line. No one is born knowing what to do. That's not how you learn to place a central line. I don't know anyone who learned to do a central line by watching a YouTube video. We're taught by experts. We practice with experts, and then we do it on our own in an organized, structured training program, which YouTube is not. I still, again, am shocked that someone would admit this online. I guess I appreciate the honesty so your patients can see who you are, but be honest with yourself. Would you want you operating on your mom or someone who's properly trained with hospital privileges and a board certification and malpractice insurance? What is going on here? Her website also says that she does all kinds of other plastic surgery, like implants and breast lifts and labiaplasties and tummy tucks. You're doing all of that stuff with only a transitional year of residency? Like honestly, what in the world is happening here? How are we allowing this? Like, it's wild. Everyone that sees this, please, if you've made it to the end, if you are considering having a plastic surgery procedure, make sure you're seeing a real expert, someone who cares enough about your safety to do the proper training, to get the board certification, to get the hospital privileges. They do all of that, not only to learn how to be an expert and be amazing at their craft, but to keep you safe.